Hello, I'm Dr. Warner. Taking care of your health doesn't have to be complicated. Small, daily choices can lead to a longer, more vibrant life. Let's take that first. Living a long, vibrant life isn't about drastic changes. It's about the small, daily choices you make today. Let's start. Let's start this journey together.
Okay, let's dive into this. Welcome to a brand new explainer where we are taking on a genuine meta of hidden causes. Right off the bat, I want you to do something for me. Just swallow once. Just once. And pay really close attention to what you viscerally feel at the very back of your throat. Is there something sitting there? Like a thickness, a coating, that just won't go away no matter how many times you clear your throat this morning? I'm asking you this directly because, let's be honest, this feeling usually doesn't happen overnight. It probably crept up on you slowly, right? First it was just mornings, and then it kind of morphed into an all-day annoyance. Actually, drop a comment below right now and let me know, is this a morning issue for you or an all-day struggle? Because I want to make one thing absolutely clear before we go any further. This symptom is a specific biological signal. It is not, I repeat, not, just you getting older. Let's move to and see how this builds. Here is our investigative journey today. First, aging mucus biology. Second, the silent invaders. Third, lifestyle and prescription factors. Fourth, the gut-airway connection. And finally, red flags and a concrete action plan. I promise you a structured path to resolving this mystery. All right, let's start with Section 1, Aging Mucus Biology. We really need to set the baseline straight here because mucus gets a pretty bad reputation, but your body produces it nonstop around the clock, and it's actually a completely healthy, normal, protective coating. It's designed to catch bacteria and dust, keeping the delicate tissues of your airway moist and resilient. Without it, your airways would literally dry out and crack. And this brilliantly illustrates our first point. Your mucociliary clearance system changes as we age. This system is made up of millions of microscopic, hair-like cilia, and their entire job is to sweep mucus upward and outward. But research confirms that as we get older, these cilia slow down. They kind of lose their beat. So what does this all mean? It means that mucus that would have been cleared in seconds when you were 40 now pools and accumulates for hours at age 65 or 70. This right here is the physiological foundation of our whole mystery. Which brings us to Section 2. The silent invaders. So we're looking at the first two hidden culprits today, silent reflux and postnasal drip. I call them silent invaders because they often work together and go completely unnoticed, mostly because they lack the classic symptoms we usually associate with stomach or sinus issues. Our first invader is laryngopharyngeal reflux, or silent reflux. Think of your stomach valve like a rubber band. Over the years, it can get stretched out and lose its tone. When you sleep, this weakened valve allows stomach acid to travel all the way up to your throat. Your throat tissue isn't built for acid, so it panics, right? It triggers this emergency thick protective mucus. And here's the wildest part. Up to 50% of people with this have absolutely no heartburn. Literally zero. It's happening completely in secret. Oh, and if you regularly use NSAIDs like ibuprofen for joint pain, you're heavily exacerbating this problem by weakening your stomach lining even further. 55. That is the exact average age for patients presenting with our second silent invader, postnasal drip. Now, this isn't that dramatic sinus infection with a blocked nose and intense facial pressure. Instead, your sinuses are just mildly swollen, constantly and silently draining slightly excess mucus down the back of your throat all day long. It is incredibly frustrating, especially because standard antihistamines won't fix the underlying inflammation here. Moving on to Section 3, lifestyle and prescription factors. Now, what's really interesting about this slide is how the things you ingest daily directly manipulate the environment in your throat. Here's a massive eye-opener. A huge study found that adults over 65 have 53% higher odds of experiencing persistent throat irritation if they take ACE inhibitor blood pressure medications. These drugs are incredibly common, but they have a documented side effect. They cause a buildup of a substance called bradykinin in the body. And confusingly enough, this side effect can start months after you take your first dose. So, you'd never naturally connect that annoying throat clearing to your blood pressure pill. Then we have hydration. Think about the difference between fresh maple syrup and maple syrup left open on the counter overnight. They're the exact same substance, but they behave completely differently. As we age, our natural thirst mechanism becomes blunted. You can actually be meaningfully dehydrated without ever feeling thirsty. So you operate mildly dehydrated, turning your normally thin, fresh mucus into a sticky, overnight maple syrup that just clings to your throat. This leads us to section 4, the gut-airway connection. This expands our medical mystery far beyond the throat itself. The truth is, your digestive tract and your respiratory system literally share regulatory pathways through your immune and nervous systems. They're talking to each other constantly. So the crucial point is, when the bacteria in your gut are out of balance, a state called dysbiosis, your gut starts sending out inflammatory signals. Your respiratory system receives these signals and responds by overproducing airway mucus. This gut-lung axis is so powerful that in clinical studies, when mice received microbiome transplants from patients with lung disease, no joke, the mice literally started producing excess airway mucus. So, what disrupts the gut in older adults? Well, it's a series of daily realities: a low-fiber diet, a lack of fermented foods, repeated courses of antibiotics over your lifetime, high sugar intake, and chronic stress. When you look at these daily realities, you quickly realize why popping a simple, temporary throat lozenge is absolutely never going to fix an inflammatory signal that's actually originating all the way down in your digestive system. Okay, let's pivot to the resolution in section 5. Red flags and action plan. Before we get to the at-home fixes, we absolutely need to establish some critical safety boundaries. While chronic mucus is usually benign, please listen carefully to these red flags: blood-tinged mucus, worsening difficulty swallowing, unexplained weight loss, a persistent lump in your neck, or a significant change in your voice. These go far beyond self-management. Do not try to fix these at home. You must make an appointment with your doctor immediately to get these checked out. But for the vast majority of you dealing with the benign hidden causes we've uncovered today, here is your daily action plan. In the morning, drink 1 to 2 glasses of plain warm water right before your coffee. This thins out that overnight accumulation immediately. Then, use a warm saline nasal rinse. Doing this consistently reduces sinus inflammation over a 2-week period. Finally, in the evening, stop eating 3 full hours before lying down. This gives your stomach valve the time it needs to close properly and prevents that silent reflux. Let's build on that with some longer-term adjustments to really put you back in control. Target about 30 milliliters of fluid per kilogram of body weight daily so you aren't turning your mucus into that overnight maple syrup we talked about. Use a wedge to elevate the head of your bed. Let gravity fight the acid reflux for you. Ask your doctor specifically about switching AC inhibitors to ARB alternatives if you suspect a medication connection. And finally, support that gut airway axis by eating just 1 serving of fermented foods. We're talking yogurt, kefir, or kimchi every single day. Before we wrap this up, we need to bust some persistent myths. Honey, it's genuinely soothing temporarily for sure, but it won't cure the root cause. Dairy? Science shows it doesn't spontaneously create mucus, but for some people it might thicken what's already there. So, trying a 2 to 3 week reduction trial? Completely valid. And please, be incredibly careful with apple cider vinegar. It's a very trendy internet remedy right now, but if you have silent reflux, introducing straight acid into your system can severely and painfully aggravate the whole shebang. Remember, we're treating addressable physiology here, not just getting older. And that brings us to the end of our investigation. I want you to reflect on what we've covered today and tell me in the comments, which of these 5 hidden causes surprised you the most? Share this explainer with a friend or family member who's been quietly suffering and clearing the throat all day long. It could honestly completely change their approach to their health. I want to leave you with this final empowering thought. Your body doesn't do things randomly. Every persistent symptom is a communication. Now that you know the language of your